I'm going to be demonstrating to you how to install a Cleo Subcutaneous set. Subcutaneous sets are typically ordered in the circumstance where frequent or multiple subcutaneous injections of the same drug are required for the patient's comfort. We'll typically see this in the palliative care setting where drugs like hydromorphone, scopolamine, or morphine are given on a regular basis through the palliation process to keep the patient comfortable. The subcutaneous site can also be utilized for infusion of isotonic fluids such as normal saline. In a palliative care setting, it can be infused up to 50 cc's an hour. In an acute care setting on a healthy adult, 150 cc's per hour is appropriate, and a 500 cc bolus can be administered over a period of 2 to 6 hours as well. So it is an appropriate site for rehydration if IV access is not available. Before installing and utilizing any device in a hospital setting, I always recommend that people review their agency-specific policies regarding the maintenance, care, and management of that device. This is no exception to that. The assessment portion of a subcutaneous set, so it should be assessed at least once a shift and up to every 4 hours if you're in an acute care setting. When assessing the site, you're looking for redness, swelling, induration, or pain at the site, as well as fluid building up under the tegaderm. All those things can indicate that there's a problem with the site and it needs to be replaced. If the patient is not tolerating the site very well or complains of excessive pain at the site, that's another indication that maybe it needs to be moved again. Typically, we will utilize the abdomen as it provides the most adipose tissue. However, the thighs and posterior aspects of the upper arms can also be utilized for subsequent sub-Q sets. Labeling of the sub-Q set is very important, and it should only be utilized for the intended drug that it was installed for. In saying this, so what I recommend to people is on your tegaderm, there's usually a piece of paper that you could utilize to date your sites. I recommend using it to date and initial your site, but also to include the drug that you intend to infuse. In this case, I have hydromorphone, and the concentration of which you're going to be utilizing the hydromorphone. So 2 milligrams per mil in this instance, which is what we typically see in our hospital here. If for whatever reason you were going to be giving a different concentration through that site at a later time, you would have to disconnect and reprime that site with the appropriate concentration that you're going to be giving. If you need to be using it for another drug, you'll have to start a separate site for that other drug, as it's not appropriate to mix drugs in one site. So the items needed for the insertion of the site, you're going to need your Cleo device, which is this spring-loaded purple mechanism here, and I'll show you a little bit more carefully how that works in a few minutes. You're going to need a lure lock or port so that you can access at different intervals with a syringe without poking. You're going to need the hub and tubing that connects to the port that is installed on the patient or the actual Cleo device. You're going to need chlorhexidine swabs to disinfect the area that is going to be utilized. And you're going to need 2 large tegaderms, and I'll explain why 2 in a few minutes. So the first step to installing the Cleo subcutaneous site is to perform your hand hygiene and don your gloves for your protection, as this is a procedure that will penetrate the skin and has risk for bodily fluids. So next, you're going to want to use your chlorhexidine swab, and you're going to want to select your site and disinfect that site from the middle, working outwards in a circular motion, to as large an area as you can that's going to accommodate your tegaderm. If you find that your alcohol swab is still a bit soiled from the patient's skin, I always recommend utilizing a second swab and repeating that same procedure a second time to ensure that you have the cleanest possible site. as it may be indwelling for a period of time. You're going to want to let that chlorhexidine dry so that the patient, or so that the tegaderm can adhere. Once the chlorhexidine has dried from your site, you can take your first tegaderm and install that on the location that you've chosen. And I'm going to save this pre-labeled label that I have for the end of my task. Once I've applied the tegaderm, the reason for this is that the Cleo device has a tegaderm film attached to it that attaches to the patient. And oftentimes it is difficult to get it to adhere to the patient when you're trying to remove the rest of the device. And putting a tegaderm prior to the installation has been found to be an effective way to manage that complication. So the device comes capped with this white cap, so you just twist it off and you can dispose of that cap. And you'll notice that there's a film on the front surface of the device, as well as a needle and a sort of a Mefix sort of like product inside there. So you're going to adhere that to the center of your tegaderm, and then you're going to press firmly down until you reach the end of the operation of the mechanism, and you're going to feel that it's spring loaded, and then you can just release that and it'll spring back to you. And that springing back to you will indicate that the catheter itself has been installed in the patient. Now, carefully when you're removing this device, as I was explaining, the film that is on the device has a tendency to be difficult to release from the device. I will oftentimes use the edge of my finger here and just sort of coax it off and just tip sideways until the device starts coming off. You're going to want to do this very slowly and carefully and try to secure the tegaderm from the device as you go, and it should be successful. You can dispose of this in your sharps container. Now that the catheter and the hub have been installed on the patient, we're ready to install the tubing and the cap. So the first piece of this is we're going to need our preloaded syringe. You're going to want to make sure that your syringe is labeled with the drug and concentration, and that the label that you intend to use is going to be the very same drug and concentration on the patient. You're going to take this now, and you're going to open up a clave or a port, and then you're going to connect to your port, and you're going to flush the port with a small amount of the drug. Once you've done that, you can now open your packaging for the tubing and connector clave. Okay, you're going to attach your port to the tubing, and you're going to proceed to flush again fluid until you see in the eye here where the connecting clave is, there's going to be a little needle. You're going to continue to flush into the tubing until you see a drop of the drug, and that will indicate that you have flushed that solution. You can now remove the paper. So you're going to notice that the shape of the nipple, I guess you can call it, on the device itself is in a hexagonal shape. The reason for that is that it can receive this port in any direction that it wants to facilitate what direction you want the tubing to go to on your patient. Before you can connect it though, so you have to pinch the sides of the device. There's two little ridged plastic pieces. You press them down and you pull the end of the device out, and that will open it up ready to install. So I'm going to install it on the port here. I want the tubing to go upward in this particular case, but I may want it to go sideways in other situations, or downward, whatever works for that patient. And you can choose that at your discretion. Once you've installed your hub where you want it, you then click the two pieces together, and you'll feel a click or hear a clicking sound once it has connected itself. And this is now ready for use. and connect it to the patient. You may at this point utilize whatever's left in your syringe to give your initial dose of whatever drug you wanted to give. So I'm going to go ahead and give my patient that drug, and then I'm going to disconnect that port. Now, with regards to the tubing, some people may want to put it in a location that is more accessible and may lead the tubing to another place and tape it and secure it as they go. Most frequently, on abdominal sites especially, I find that people prefer to just coil up the tubing to the side here and leave a tail with your injectable port. And then you'll utilize your second tegaderm. You'll utilize the second tegaderm to secure the whole thing together. Like so. There. And just make sure you smooth out all the edges there and everything's good. Once you've completed that task, you want to make sure that you install your label to indicate what it's going to be used for. And you will only utilize this one port for that drug. If you need another drug, you'll need another port. And there you go. You're now ready to utilize this. You can connect a CAD pump to this if you want to directly into the port. Or if the CAD pump is the first step to the reason you're putting the Cleo, it can be installed directly into the tubing if you want to avoid utilizing a port. I see no reason why a port wouldn't be a good idea either way. And there you go. That's your Cleo Subcutaneous set.